Hey there. Today we're going to be looking at how you can automate your patient intake process with our built-in forms. In the settings, you go to this new section called Forms. Here you can see all the templates we have, what forms you've saved, and the published forms. So form templates are the forms that we've made for you, and saved forms are which templates you've saved. And finally, published forms are a collection of all the saved forms that you've published separately. So, for example, maybe I only need a PHQ-2 and a new patient information form. You would save those. Mine are already saved, that's why they're gray, but you'll see a green button, click Save, and that'll put them in the Saved Form section. So now let's say I want to have a patient intake form collection of new patient information, health history, and PHQ-2. What I'll do is go to Publish Forms, call it New Patient Intake. I want the new patient information, the health history, and PHQ-2. I'll save that. And now you can see a new published form is this new patient intake, which contains these three separate forms. We'll also give you a link to your own website where you can publish on your website for patients to go to fill out these forms. So yours will be your domain name .acutehealth.com/forms/some ID number. If you don't already have a domain name under acutehealth.com built for you, then let us know and we'll build it for you. So I will go now to this address to show you what it looks like. So just click to copy it. So this is the patient intake form page. Your patients will enter their information here. We'll match that to the database and proceed from there to make sure they're an existing patient. If they're a new patient, they'll be able to enter in more information and actually sign up on this page as well. So this is a patient, and you check that they're not a robot in the reCAPTCHA to prevent any bots. They'll click next, so we match that to an existing patient, so now we show the form to the patient. And any required forms have the little asterisks here. And let's just say they put something, and if they don't know, they don't have to fill it out. And a lot of sections have add option, so if you have multiple insurances, you can add that. And this is a contact section, so say Jane is mother. And this auto-completes so they can choose from the drop-down. And there is email validation, so if they enter in something wrong, it'll tell them. And same with phone validation. They can even put a language in here. And we also auto-complete languages. We have several hundred languages built in. So here is the health history questionnaire. They can put the previous doctor information, a childhood illness. So we have some options to choose from, but they can also put in any other, if they want to search, such as fracture. They can add immunizations. We have all the vaccines that are on the standard vaccine schedules here. And any diagnosed conditions. We also have surgeries, hospitalizations, drugs. So for drugs, we also autocomplete with the NDC database. So if they were to search amoxicillin capsule, we will only show them strengths that are actually valid for this drug. And then they choose a frequency, not every hour. And this will actually show the NDC code in their answer response in their chart. And same for allergies, if they search amoxicillin, we autocomplete it. And none of these are required, so I'll keep going. There's family health history you can add. There is a women only section, men only section, and any other problems. And then click next. And then finally the PHQ-2. And now the answers have been submitted, and you can see the answers in the patient's chart. So going back to the patient's chart, there's a similar forms button in the patient chart, and you can see all the forms that have been submitted by the patient and when they were submitted. So I can see the new patient information here, the health history, you can see amoxicillin drug and allergy, and the PHQ-2, along with the score from the PHQ-2, so you don't have to score it yourself. And that is a quick look at the automated patient intake forms. Let us know what you think in the comments below. Thanks.